Podcasting from St. Louis, Missouri, this is Functional Wellness with Dr. Allison, your information and inspiration hub for all things health, wellness, and functional medicine. Your host, Dr. Alison DiBarto Goggin, has been practicing functional medicine for over 11 years. She is passionate about finding root causes and solutions for gut health, hormone balance, anxiety, and autoimmune conditions. Welcome to the show. Are you wondering what functional medicine is, what can be diagnosed, what can be treated, how does this all work? Maybe you've been sick before and you went to your primary care and then they referred you to maybe a GI and then a rheumatologist and then a dermatologist. And you felt like you had to keep seeing different doctors who were diagnosing different things, but maybe nothing seemed to get better. Or maybe you feel like everything is connected, that there has to be a root cause for everything that's happening to your body, but everyone seems to be telling you something different and no one seems to be saying the same thing. And you really just want to get down to the bottom of what's going on with your health. Welcome. I'm Dr. Alison DiBarto Goggin. If we haven't met yet, I'm a functional medicine physician and doTERRA wellness advocate, and I help women overcome chronic health issues, anxiety, and weight gain so they can feel like themselves again and feel healthy and vibrant and full of life. Today we're talking about what is functional medicine. Functional medicine is a term that encompasses physicians and doctors who look at the body as a whole. Instead of seeing multiple doctors with each one focused on a specific organ system like a GI or a rheumatologist, a functional medicine physician focuses on the whole body at one time. We understand that the body is connected, our organs work together, and that no system is separate from the other. You can't have a problem with one issue in one system and it not affect the rest of the body. We want to look at all of the patterns and trends in your health to see if we can put together this puzzle of what's going on with you specifically. My patients typically have multiple issues going on at one time. For example, a patient of mine came to me wanting to lose weight, which was her main complaint, but she also struggled with IBS, with anxiety that wasn't responding to medications or treatment. She also had hormonal changes and acne that she was worried about. Her hair was falling out. She saw a thyroid specialist, but they were told her nothing was wrong. But she knew that all of these things were connected, but couldn't pinpoint exactly why she couldn't lose weight and why she couldn't feel good. The other thing is she got prescriptions for each specific issue, so she was taking a ton of medication at one time, and the doctors were telling her different things about supplements and food and exercise, and she didn't really know where to turn to. When I worked with her, we did a specific blood test and a general blood test as well. We did a hormone evaluation and a stool test to see exactly what was going on in her gut. We found that her intestinal enzymes were actually the root cause of her estrogen dominance, which were affecting her hormones. So her hormones were cycling continuously through her body instead of being used and getting rid of, and her intestines were the main cause of that, which also led to her IBS and her digestive issues and why she wasn't feeling good. We also found that her vegetarian style of eating was leading to some nutritional deficiencies in malnutrition, which then affected her brain and her anxiety and her energy, as was also struggling because of these issues, and she had insomnia. So we really got a deep dive into what was going on with her body and what was causing these issues. Once we cleaned up her diet and added in the nutrition that she needed, picked out the right exercise for her hormone and body type, we balanced her hormones with supplements, and changed her workouts from high-intensity interval training to slower, more Pilates-type exercises. She was able to start sleeping through the night. She was able to have her energy improved. Her anxiety went down dramatically, and the weight started coming off slowly but surely, because we had to do a lot more internal work before we started worrying about the weight loss. Her root cause of her symptoms was actually multifaceted, but we were able to see her body as a whole picture, and that's what we do in functional medicine. Instead of just saying weight's on one side and the hormones are in another segment and the anxiety is completely not related, we see all of these things as being related and can work on them through a lifestyle standpoint. Functional medicine doctors work with a variety of patients. Now, some will be specialized, some won't. For someone like me, I work with all types of patients, from mood, anxiety, and depression type issues to digestive with Crohn's, colitis, and IBS, to hormones with infertility, PCOS, and people who are struggling in menopause, as well as individual things like wanting to lose weight, wanting a meal plan, or just wanting more energy in general. Some of my favorite tests include the GI map from Diagnostic Solutions. It is a stool test. You get to do it at home, mail it right back to the lab. But what I catch is so many underlying infections like H. pylori or Epstein-Barr, and it really affects how the body heals and it affects the immune system. For people who have chronic infections or always have the cold that's going around or the flu, they might have a weakened immune system or other infections that are causing these issues. For most of my pediatric patients, I always run a stool test because their eczema or their psoriasis or their mood issues are actually coming from imbalances in the gut, not just probiotics or opportunistic bacteria. This is not a good or bad bacteria conversation. This is a what's overgrowing, what's infected, and what's causing issues. And when we clean those issues up, we can really see a healing of the whole body. It's amazing. My other favorite tests include the Dutch test for hormones. You can go to thedutchtest.com. I also like saliva testing for hormones. It really just depends on what that person is experiencing. And then I also love the organic acids test for nutrition and infections and all sorts of different things that this test pulls out. So it really helps us get a big picture of how the body is functioning. Each patient is so different that many people will send me a message and say, hey, what do you do for fibromyalgia, or what do you do for migraines? And honestly, we don't have protocols, which is the most frustrating part of functional medicine. I understand. But because each patient is different, your protocol will be different. People may have migraines for a multitude of different reasons, so we really dig deep to find out why you're having the issue before we just say, oh, migraine. And then I also love the organic acids test for nutrition and infections and all sorts of different things that this test pulls out. So it really helps us get a big picture of how the body is functioning. Each patient is so different that many people will send me a message and say, hey, what do you do for fibromyalgia, or what do you do for migraines? And honestly, we don't have protocols, which is the most frustrating part of functional medicine. I understand. But because each patient is different, your protocol will be different. People may have migraines for a multitude of different reasons, so we really dig deep to find out why you're having the issue before we just say, oh, migraines, I always use this herb, this supplement, and this oil, you'll be fine. Because we don't want to band-aid and just give you pain relief. We really want to get to the root cause of why you're having the issue so they don't come back. Treatment really depends on what type of doctor you're seeing. While an MD might prescribe medication or surgery, someone like me as a chiropractor, I cannot do that. So for my practice, my goal is to work on lifestyle support, nutritional, and habits to help you manage your symptoms and create health for your body. We do that through your 90-day plan that I write up based off of your testing, your symptoms, and what the root cause of your issue is. Many times we can normalize hormones, digestive issues, all sorts of things through food, supplements, and just righting the body. I do work very closely with a number of primary care physicians, physical therapists, food therapists, nutritionists, so we always have a referral base that you can have a team to support you through your whole body. And if you're looking for personalized help, I would love to help you. I always offer a free health assessment for you. You can click the link in the description here to schedule online, and that way we have about 30 minutes to chat about what you need, what your goals are, what your symptoms are, lay out a plan for testing if you need it, and what we need to do to move forward. So thanks for tuning in. Make sure you like and subscribe so that way you stay tuned for all of our weekly videos, and we'll see you next time. Thank you for listening to Functional Wellness with Dr. Alison. If you would like personalized care and testing, you can schedule a free introductory consult with Dr. Alison online at Little Black Bag Medicine or message us on Facebook at Little Black Bag Medicine. Thanks for tuning in, and we'll see you next week.